is a conversation about justice in the era of a global pandemic. Now, justice is an elusive goal at the best of times, and these are certainly not the best of times. It's also a very broad term, and we hope this evening to explore the idea of justice in the era of COVID-19 from multiple perspectives, to look at the ways in which this virus has illuminated injustice in the world and potentially illuminated positive paths forward. One of the challenges of the virus, of course, is that it has pushed us to isolate. But at the same time, it's also allowed us to create new connections. And one of those new connections for me is to these two terrific women that you'll meet tonight. I've been eager to get to know them better since they each came to NYU. And so for this opportunity, I am incredibly grateful. I'm going to introduce you to them now in alphabetical order. But first, I want to recognize and thank the Cross-Cutting Initiative on Inequality, created 3 years ago by the offices of the President and the Provost, and now involving more than 80 faculty across the university. In particular, thanks to Ashley Gerhardt and Carolyn Dorson, who've made the webinar in this 3-part series on inequality possible. And Ashley asked that you stay on afterwards to take the survey. But now for my introductions. Deborah Archer. Deborah, raise your hand there maybe just to say hi. JD is an associate professor of clinical law and co-faculty director of the Center on Race, Inequality, and the Law at NYU School of Law. She's a nationally recognized expert on civil rights and racial justice. And it's worth noting, given the topic of our conversation, that she worked as an attorney with the ACLU and the NAACP Legal Defense and Education Fund, where she litigated in the areas of voting rights, employment discrimination, and school desegregation. She's currently a member of the National Board of Directors of the ACLU and served on the New York City Civilian Complaint Review Board, the nation's oldest and largest police oversight agency. And among multiple honors, was selected as an Aspen Ideas Festival Scholar. She received her JD from Yale Law School, where she was awarded the Charles Album Prize, and her BA from Smith College. Angela Hawken is a professor of public policy and director of the NYU Marin Institute of Urban Management, about which we'll learn much more tonight. She's the founding director of NYU's Beta Gov, which supports innovation and testing for social good. She directs a community supervision resource center for the US Department of Justice and the NYU Opioid Collaborative, which works with justice agencies in 6 states on designing, implementing, and testing responses to the opioid crisis. Most recently, her team has been helping prosecutors harness their own data for equitable decision-making through analysis and decision support tools. Before she came to NYU, she was a professor of public policy at Pepperdine, a research economist at UCLA, and an associate policy analyst at the RAND Corporation. She has her BS and an honors degree in economics from the University of Witwatersrand and a PhD from the RAND Graduate School. So I'd like to begin, as the moderator did last week, by asking if you would each share something from your personal lives that shaped or still shapes the work you're doing. Angela, do you want to start?
Sure. Thank you, Ellen. And it's great to spend time with you and Deborah tonight. I appreciate the introduction. So I'm not a criminologist. I'm also not a lawyer, but I am interested in human behavior and institutions and legitimacy in government and public policy. And in my work over the last 2 decades, I've spent a lot of time in prison. So even though this is a work example, for me, it was really personal. In 2015, I was moved by an experience when I watched a man being released from a maximum security prison. The guards met him at his cell and they put him in a cage and then wheeled him to the gate. And at the gate, they unshackled him, pushed him through the gate and slammed the door behind him. And that was prison release for that man. And he was obviously completely unprepared for what faced him on the other side of those gates. And you know, in many states, prison release is $20 in a bus ticket. So good luck staying out of trouble in those conditions, right? And 2 and 3 don't succeed, and then we wonder why. So I'm still haunted by that experience. It's been hugely influential on the work that I continue to do today.
Thank you. Deborah?
So I think, at least my parents would tell you that I've always wanted to be a lawyer, and in many ways, I think that society pushed me in that direction. I grew up in Connecticut, the child of Jamaican immigrants, first person in my family to go to college. And my parents worked really hard, yet struggled every single day to provide basics for our family. And they also faced intense discrimination because they were immigrants, discrimination because they were Black, discrimination because they were poor. And this is discrimination they couldn't shield their children from. And when I was younger, my parents moved from Hartford, Connecticut, to a working class suburb of Hartford because they wanted to give us a better chance for a good life, to live in a safer neighborhood, to attend better schools. And the neighborhood we moved into, we were one of 3 Black families to live in that neighborhood. And our neighbors weren't happy about it and let us know that. And I remember one day waking up to find that our house had been vandalized, that KKK had been written on our house and our car. And I was so young, and my parents had to explain to me and to my brother what KKK meant, why our neighbors didn't want us in the community. And it just made me scared. I felt out of place, like I didn't belong. I was afraid to be in that house, to be in that neighborhood, to walk the streets, to play in the playground. And I was even afraid to go to school for some time. And I ended up having to live with my grandmother for a little while. So I figured out pretty early on that I wanted to fight against that discrimination that my parents struggled against every day, the discrimination that tried to drive us from our home, that forced my parents to move from a predominantly Black community to a predominantly white community just so that we could get a better education. And that discrimination that I continued to experience throughout my life. And I figured that being a civil rights lawyer was the best way to do that.
Indeed. So Deborah, you came to NYU Law School just a couple of years ago. Tell us a little bit about your context there and your work there.
So as you mentioned, I was a civil rights attorney for some time, but I've been a full-time law professor for almost 17 years, and I very much view that as a continuation of my civil rights work. I've been at NYU for 2 years at the law school, and my primary teaching responsibility is the Civil Rights Clinic. And the Civil Rights Clinic is a year-long course in which my students and I represent victims of injustice and discrimination in a variety of substantive areas, ranging from employment discrimination to voting rights, school desegregation, criminal justice reform. And what I'm trying to do through the clinic is to move my students along the process of becoming multi-dimensional lawyers who are able to take on the complex, multi-dimensional social justice issues that we see today. And in that regard, I've tried to model my teaching and channel my inner Charles Hamilton Houston. And for those who don't know him, he's a former dean of Howard Law School, former director of litigation for the NAACP, and also the architect of the litigation campaign to end racially segregated schools. And what he taught his law students was to not only conceive that separate can never be equal, but he also taught them how to develop a legal theory in support of that idea, and then to develop an integrated advocacy campaign and advocacy strategy to turn that theory into reality, to give it legal effect. And so in my clinic, I aim to help students understand current legal framework for equality and develop the ability to utilize that framework creatively on behalf of their clients. But I'm also trying to help them transcend and reimagine current institutional frames, to conceptualize avenues for relief, to create new narratives, and to think about the building blocks for rights that maybe didn't exist before. In my research, I broadly focus on identifying and challenging sources of racial inequality in particular, but other forms of inequality as well. Recently, I've had a more specific focus on understanding the modern drivers of racial segregation and concentrated poverty, and exploring what predominantly white communities have done or are continuing to do to kind of ward off racial integration, and to keep the opportunities and resources within their communities to themselves. And that's included exploring a range of things, from the role of mass incarceration, the way that mass incarceration is blending with housing policy, all the way to infrastructure development. And then finally, I'm the co-faculty director of the Center on Race, Inequality, and the Law at the law school. And the center was created to confront the laws and policies and practices that have led to the oppression and marginalization of people of color, it's a broad mandate and our work is equally broad.
Thank you. So Angela, tell us a little bit about the Marin Institute. You described it as a think do tank when we were getting to know each other. So tell us more about what that means and how it operates.
So, Ellen, yes, that's exactly what we are. We are a think do tank. So we're a pro-both institute, and our mandate is impact. So what a neat job, right? Just having a job where you're told, just be useful, right? And that's what we are held to account for. And that's really what attracted me to the Marin Institute. So we invest in academics who are interested in applied on-the-ground research, working with urban managers, alongside urban managers and practitioners. And all of our programming areas in some way or other tap into issues of inequality, which is why I'm really thrilled to serve on the Cross University Initiative. And we have programs in urban expansion, making sure that as cities expand, they make space for the people who live and work there and in a way that they can afford the housing to be there. Equality program, we're making sure that the communities that are most harmed by the harms of inequality, that the resources flow to those communities. Our civic analytics program uses big data to really highlight a lot of the the inequities we see, for example, in responses to 311 calls. The same issues with with education, looking at disparities in education, transportation issues. Now, how do we make sure that transportation is affordable? How do we bring down the cost of providing the infrastructure so that it can be affordable? And then city finance, looking at, which would be really relevant now, what happens when cities go bankrupt and who are the losers in that. So our faculty do, we do teach some classes, but teaching is not our core mission. Mostly we run research projects and we raise external funding to support those projects. But we do work really closely with students in a different way. We really offer kind of a great opportunity for students who want, very applied research experiences. So at any point in time, we usually have about a dozen students working with us. They work with us as colleagues, as part of our research teams. They interact with our government clients, and they come from all parts of NYU. They're data scientists, they come from statistics, business school, engineering, arts, you name it. And we love it that way because a diverse mix of thinkers always makes our projects richer, and we're really grateful to have them. So in a nutshell, that's what we're up to.
I have to say, I also love that you described your institute as a think do tank, and I might borrow that. It's so incredibly important that we're not only spending time to think about these ideas, but that we are finding ways to implement them or to support the people who are trying to implement them. So I absolutely love that, and I may steal that.
So please steal it, but even I can see you and raise you, and that is, we also really are collaborative by nature. Our work is really applied, and we love to work with faculty working on other issues. So we are a good place, kind of a meeting ground for faculty from across the university to come together on projects where we have common interests. And I know for sure, in the brief time we've known each other, that we'd have several projects in common.
So let's just follow that thread for a second, Angela, so that if there are faculty who are listening to this who have a particular interest in research that has an impact, they can talk to you about ideas and explore whether Marin might be a good home for them.
I think there's a couple of ways too. There's collaborating on projects, but we also work really widely with government institutions and community-based organizations across the country and in other countries. So if a researcher is thinking of starting a project but needs sites, for example, to do that research, we're a really good place to start with a call to say, hey, do you have anything happening in Seattle or in this side? We need multiple sites. Is there anybody you can introduce us to? So I think we're a really good source of introductions also, as well as collaborators.
Terrific.
And just to follow up on the collaboration point, as we're talking about justice, I think the collaboration is incredibly important as we fight to advance justice and move the needle a little bit, because problems are so complex. You need people who are focusing on education issues, but education issues are also housing issues, they're also employment issues, they're also health issues. And also in the legal context, it's important to be able to pursue litigation, but you also have to be able to work with people who are building power in impacted communities, who are engaging the press, who are thinking about legislative advocacy. So much of what we need to do to fight for justice is about working in teams and being collaborative.
Absolutely. So let's talk a little bit about criminal justice. One of the things that's interesting is that more people are being released from jail and prisons these days than had been for a long time. So in New York City, the jail population is down 30%. Governor Newsom announced in California just a few days ago that he was shutting the juvenile facilities at the state level. While the release is a good thing, the challenges of people who are being released are significant. So I want to hear from both of you about that. Angela, let's start with you.
Sure, so and you're exactly right. So we're seeing big decreases in some places, and for example, the number of people housed in jails, and we're even seeing some reductions in prison populations. And there's many reasons for that, right? Police are making many fewer arrests. There's fewer cases being prosecuted. Courts are not functioning the way that they did. And so and people in custody are at much greater risk, right? They're living in circumstances or breeding grounds for infection. And so we are seeing these kind of these releases, but to reduce the density. But these are really consequential decisions, because not everybody gets released. Who gets to be released and who isn't? So there's so many issues of fairness wrapped up even in the release decision, right? Because people in custody are stressed out, their families are stressed out. So you really need to have good, fair, transparent practices. And the circumstances that they're being released to are really quite dire. So we're actually, in a way, very glad to see the states and the cities step up in reducing those populations, but we're trying to impress upon them, you can't stop there. People are releasing to, just miserable economic circumstances. They're competing for scarce resources, and there's really so much more to be done to make sure that they just don't immediately fall through the cracks at the time of release. So yes, it's an especially challenging time. So we've been working with states, on what does release policy look like? How do we make it fair, but how do we make sure these people are better prepared around the time of release?
And Deborah, some of your work looks at crime-free housing ordinances and policing-based housing policies, which complicate life for people being released and their families. Could you talk a little bit about that?
Yeah, first, just to touch on what Angela said, I think it's important to note that the tools that we are using to get folks released are tools we've had all along and have chose not to use. And that's a challenge with a lot of the problems we see. We are told that they're too difficult, too complex, but we're releasing folks early using things like medical furloughs or clemency. Judges don't have to set bail, police officers don't have to arrest. And so hopefully those are things that we will tools we continue to use moving forward. But as Angela said, and you pointed out, Ellen, folks are being released from prisons into situations that aren't conducive to their long-term success and may, in fact, result in them reoffending and being rearrested. For example, a lot of the people being released from prison are disproportionately from certain neighborhoods that are struggling against systemic and structural inequalities, neighborhoods that are under-resourced in terms of economic opportunities, in terms of housing. And that's even worse now that the resources in those communities are stretched thin.
And so are the nonprofit organizations that would often support them. Their resources are.
That's right. And even more specifically, those folks are being released into a system of laws and rules and regulations that make their successful reentry challenging, to say the least, under the best of circumstances, and now even more so when the community supports are stretched thin. As you mentioned, some of my research focuses on the growing web of policies that prohibit people from living in public, subsidized, or private housing if they've had any level of contact with the criminal legal system. And when you take all of those together, these policies can really put stable and affordable housing out of reach for some of the people who need it the most and who may find themselves exiled and excluded from the communities that they call home, or being released and not being able to live with family members at risk of those family members losing their houses. And in the beginning, these exclusionary programs started in public housing. Now they've migrated into the private rental housing market through something called crime-free municipal housing ordinances that have really popped up around the country. One study says there are about 2,000 crime-free ordinances around the country now. And these ordinances are local ordinances that require or encourage landlords, private landlords, to either evict or exclude folks who have had even minimal contact with the criminal legal system, sometimes folks who've just been suspected of a crime, but have not actually been arrested or convicted. And And as you can imagine, it has a racially disproportionate impact as you lay over some of the racial disparities of the criminal justice system into the housing market. It's impacting people who may need the housing and the support the most. And as the number of these policies have expanded, and policing is kind of integrating itself into housing policy, it's really becoming entangled with assumptions around excessive criminality of people of color and our steady march towards mass criminalization. So it really is a problem always that there are housing restrictions that don't support people who need support re-entering their community and being with their family and community to get the support that they need. But it's even more of a problem now that folks are being released into situations where those of us with the most resources are struggling to survive.
And something that really follows from that is that, you know, we will all be quick to, as we should, try to draw lessons from this experience, right? So all of us, there's these natural experiments that are happening, and it's like, so we have a large number of people who are now receiving an early release. Pre-COVID, we were working on the issue of early release, but early release done well. Right now you have early release and it's done, you want it to be done, but it's done into terrible circumstances. So anything that actually evaluates this experience could be capturing the essence of early release at the worst possible time, which we actually worry could actually undermine other efforts, other policy efforts to think through rational approaches of early release that really provides the appropriate supports. In the early release work we were doing, we really made sure that the savings from the prison reduction followed those people into the community so that housing could be provided, basic needs were met. And that's what you really need to set someone up for success, but letting them out into these really dire circumstances, we actually worry that this could be counterproductive for criminal justice reform in a way, if we study these cases without recognizing the circumstances that people are released to. And Ellen, you mentioned the community-based organizations. We actually have a report coming out soon on the community-based organizations that are so essential to assisting these people who are coming home. And they'll be even more essential now, except that they are so stretched thin. We're seeing CBOs that are down staffing positions. Some of them are closing shop. So it really is, you know, a very tough time for even the service providing organizations out there. We have a report, in our report coming out, I hope we can push it through here, is we are identifying kind of federal funding resources for states to tap into to actually support. It's an unusual way of doing it, but we found a way to actually support those community-based organizations so that they can stay in place and help those re-entrants.
Say more about that. And what's the theory behind that and the operationalization of that?
So we have, it's the burn JAG funds that are usually used for other kind of criminal justice and even law enforcement responses, but the way it's written is actually an avenue to provide those resources to facilitate the release. So we have, as I said, we have a report coming out, you can read all the details there, but these CBOs are going to need lifelines, you know, and it's not just that they're competing with other people in re-entry who are relying on these service organizations, they're competing with other people too. So there's very few resources to go around and everyone's grabbing for them. It's time to really improve, you know, increase the capability and capacity of these organizations, but at the same, but it's the opposite is happening right now. So it's really sad to see.
I hope that folks will view things the way that Angela has laid them out. I'm afraid that we will release folks back into their communities without the supports they need, and when they end up reoffending, or if they're or arrested or unable to manage, that we're going to look at that as a reason to not engage in criminal justice reform. They're going to say that's what happens when you don't have bail, and that's what happens when you don't give longer sentences, rather than saying, right. So how did we fail? What should we have done to better support people and to make those reforms, and instead use this as a way to take a step back rather than taking a step forward.
Right, and this is what happens when people get released and they don't have support, they don't have jobs, they don't have houses. This is really actually what happens, yeah. So much of the public health conversation is about individual behavior. Wear a mask, wash your hands, those kinds of things. And yet what we're seeing, if you look at from a justice lens, is the structural inequalities. And Deborah, you mentioned that word before, but how is it we can begin to understand the connection between what's legitimate individual advice, like we should all be wearing a mask and washing our hands, and the revelations of the structural inequalities that have led to the disparate impacts. So how do you think about that?
So there's an old saying that has popped up a lot lately that helps me when I'm thinking about that. And the saying is that when America catches a cold, Black people get pneumonia. And it really does, in many ways, explain what's going on. COVID-19 was introduced into a society and into systems that are racially discriminatory on an individual, structural, and an institutional way. So people of color are not more innately susceptible to coronavirus, but because of years of inequality, are more likely to be exposed to the virus and are at greater risk of developing complications. They're also going to experience a disproportionate share of the fallout from the virus, from the lockdown. So long-standing disparities in access to hospitals and doctors, community hospitals that were closed or chronically underfunded, kind of eliminated social safety net hospitals and contributed to people of color being less likely to be tested for the virus and also have more severe impact after they were exposed to the virus. Highly dense, segregated housing in under-resourced communities contributes to racial and ethnic disparities, as does the likelihood of living in housing or a community that's plagued by environmental stressors like lead paint or lack of access to clean water or having highways that run through your community and increase pollution. The greater likelihood of working in low-wage jobs or of losing your job or being compelled to work out of economic necessity or not having the luxury of working from home all contributed to racial and ethnic disparities. Low-income students, particularly students of color, are going to be the ones likely to suffer from the closing of schools, losing access to school lunch programs, and not having access to the equipment or the internet or even the space to really benefit from remote learning. We're going to see all of that impact in communities of color. So we do need to look at some of the immediate inequities that we're seeing as flares. There are emergencies and we need to respond to those emergencies and get people whatever they need right now, but we also have to make sure that we attend to those fundamental structural and systemic inequalities which have resulted in these imbalance, burden, and disparities. And then finally, you mentioned the individual behavior, and often even those claims and that it's about individual behavior have to be understood as they're layered over racial inequality. So let's look at the kind of dilemma that Black folks face around using face coverings. So that you could, that requirement it has to be taken in light of the myth of excessive Black criminality and that Black people are immediately suspect. And so Black people faced the choice of wearing a mask, protecting your health, but then being deemed suspicious and not being denied service, or not wearing a mask, risking your health, being harassed by the police, or again, being denied service. And we've seen that play out in the way that social distancing or mask requirements have impacted people of color. So it's certainly, there are steps and questions and concerns and issues we should raise around personal behavior and personal health issues, but we cannot ignore that all of these calls for personal changes in personal behavior are layered over deep and long-standing structural inequalities.
Absolutely. And the question of what are you thinking about how we're going to get our collective attention on this issue, right? How might we use the realities that we're facing now to get people more focused, not just on getting over the pandemic, but addressing the structural inequalities?
Part of it, I think, is about a conversation. We generally, I'd say that in the past several years, are having more robust and frequent conversations about inequality generally, racial inequality, and economic inequality. But I still think that although we throw around terms like structural inequality and systemic inequality, the conversation is still really about individual behavior in individual actions. It's an uncomfortable and challenging conversation to have, to identify the structures, the systemic structures of inequality, and develop the tools to tear down those structures. And I think a lot of people are still avoiding having that difficult conversation.
All right, we have two questions and they're coming in, so thank you. The first is, are there special issues around juvenile justice we should be aware of during this time? Angela, let me turn that to you.
You know, one of the concerns I have, so we work with a number of juvenile justice sites, and one of the concerns we have is just in general, this, you know, restrictions on facilities now are so serious, and these young people are of an age where the programming side is more important than ever. Young brains are developing, and so access to kind of those friendlier faces and the service providers is being, you know, is really being cut back, and so that is a concern. We have, you know, we have a project right now that involves young men. They're mostly young men of color. They're in the community, and just echoing Deborah's point, you know, wearing a face mask in the community is difficult if you're Black. It's especially difficult if you're Black and you're wearing an ankle bracelet. So we have, you know, these sorts of concerns. Also, even on the juvenile justice side, we don't know what's happening with family violence now. And, you know, we know so many people in the system have been traumatized in their past. We don't know what's going on, and it's going to take us a long time. So we do worry about kids. You know, we also know, Deborah mentioned education, and we have a project on schools now looking at access to education and the educational deserts. What are these educational deserts eventually going to mean for the justice system? Because a very strong predictor of subsequent justice involvement is whether you can read and comprehend in third grade. And, you know, having teachers, it's great that teachers are providing online resources. It doesn't help if the kids can't access them. So we're going to have so many additional challenges. One thing I do want to do is maybe be a little bit more optimistic than on some of the systemic issues. And the one is, we've always been, I think many of us share the concern of over-incarceration, and how that has really been disproportionately an issue for people of color, just the excessive use of custody. One thing in the wake of COVID that is very likely, and we saw this after the last recession, is the terrible budget constraints that the states are going to face. These budgets are going to be slashed. And now on the one side, that's bad news, because it means a lot of the service providers in custody settings will go too, because programming is the first thing they cut. But it also likely means a shrinking of prison populations. And it also likely means that we're going to be much more mindful about who we actually send to prison and for how long. And we're pairing that. So the timing for that is actually kind of good, because we're pairing that with some really great recent public opinion polling in the last few years on where is the public on this issue. And the public is overwhelmingly now in support of criminal justice reform, including sentencing reform, and including revisiting those sentences of the old that were issued, that were handed out in the era of tough on crime, those mandatory minimums, even the willingness to revisit those. So it's possible that there is a glimmer of hope in this, but it'll probably come for all the wrong reasons, and it's going to come because of budget cuts.
Well, there's one of the questions that came in was, what is one thing in your work or in the world that gives you faith in positive change in reducing disparities that you outline? Deborah, do you have a glimmer of a hope?
Always trying to look for hope. I would give two things. One, that's related to the current crisis that we're in, and one more broadly. The more broad one is that I have hope because young folks these days are so on top of it. They're so activated. My clinic has worked with an organization here in New York City called Teens Take Charge. And each and every day, I am wowed and overwhelmed by the work that they're doing. They are far more creative, aggressive, and less patient than many of us are with the injustices that we see. And I think if we all take a minute and learn from the work that young folks are doing individually and through organizations that they have put together, then we can see that there's a lot of hope that there will be change in the future. In the context of COVID-19, I think we have to take advantage of this opportunity that things that we have been told were impossible are in fact possible. Issues around helping children get access to technology at home that will enhance their learning, getting housing for folks who are experiencing homelessness, reducing the population in our prisons and jails. We now see that that's possible to do, and possible to do very quickly with tools that we have at our disposal. And so I hope that this means that people will stop taking no for an answer. will stop pushing when we're told that that's too difficult, because things that we thought were too difficult are in fact not too difficult. And the challenge that we're going to face after this is all over is for people to get activated and make sure that these policy reforms stay in place, that we continue to give services to people who need them the most in the way that we've been giving them now. I think about in New York City, where students are now getting educated at home. We don't have the ability to use the many, many layers of screens that we used to use to keep certain children out of our highest performing middle schools and high schools. And so for admissions for next year, they're not using those screens anymore. They're not going to use attendance and test scores like they did before. So let's not let them go back. They've shown that they don't have to, so let's not allow that to happen. And I think we also need to ensure that potentially dangerous policies remain temporary. So thinking about some of the surveillance, increased surveillance that's popping up. But certainly there's signs for hope broadly out in the world, and also even signs of hope in light of this pandemic.
I would definitely agree with that. We've seen some really bold changes that we wouldn't have predicted pre-COVID. And increasingly, even on calls with some agency directors, we're hearing them kind of echoing this language of we're feeling cultural change among our staff. We've been encouraging these sorts of changes. There's been a lot of resistance. And now, you know, my probation officers really see their jobs differently. They're out there trying to work, you know, with the people they're supervising, trying to do what they can. It's tough, but they're working together. Let's see, you know, let's see if this persists. But it is a glimmer of hope. And even I have to say, we have a site in Washington State, and you know, it was the Seattle Police Department that marched into the custody setting where they had never allowed the internet before. The PD brought in the internet and said, these people need this. They need found housing. They need access to services. Let's do this. And they just broke through so many barriers that had previously been put in place. So we see examples of those all over. I really hope the researchers will be there to catch those nuggets, to study them. So we have to study them to make them become part of an evidence base so that we can keep them there after the pandemic passes.
Here's an intriguing question. How can we understand the media's use of language of war during this pandemic as it functions to create martyrs of the essential workers, most of whom are people of color? So the sort of, you know, the war on drugs, now we have a war on the pandemic. How does that shape our understanding of what's going on and the likelihood that the lessons we learned during this get applied time?
I think the question actually hits all the points. When we use the term that we're at war, it makes it seem like we are going to take extraordinary measures, and that those extraordinary measures are temporary. They're temporary measures we take only during the times that we're at war. And some of those measures should in fact be temporary, but a lot should, as I said before, become part of our normal lives. I think people who are interested in justice and racial justice, a flag is raised when we use the term war, the war on drugs, for example. It makes it seem like there will be casualties and it's okay for there to be casualties. And as the person who asked the question pointed out, here it makes it seem like it's okay that there will be essential workers who are casualties. And those essential workers, as we mentioned, are largely people of color. And I think we have to question kind of the underlying message that we take in when we use those terms.
There's a question here about the communities of immigrants, also with a disparate impacts. And either one of you want to speak to that?
Angela, you want to go first?
I think it's really just everything that Deborah has been speaking about already in many ways applies there. You know, access to healthcare. These are vulnerable communities, often not willing to approach the police when things are happening, not able to get access to the healthcare that they need. In one of our upcoming studies now, we're also mapping the ICE facilities for, we have an early warning system of those facilities that will be vulnerable to COVID, and to start to mobilize an effort around really making sure that communities are well equipped to make cases, to really improving the PPE and healthcare work, and as well as reducing the density in those facilities. But everything that Deborah has been speaking about already, I think really applies in those communities in a big way. And
I would just highlight that, unfortunately, immigrant communities and are excluded from some of the safety measures that we've implemented. They're not getting the support that many other members of our communities are getting. They're not eligible for that support. And the other challenge is, I think a lot of immigrants are afraid to come forward and ask for the support that they need because of some of the narrative around immigration and immigrants that we've seen in the public discourse. They've been targeted and have felt targeted before this, and in many ways have been targeted even more since this. So they're not eligible for a lot of the benefits, which is problematic. They're equally impacted or even more severely impacted than other communities. And then they're afraid to come forward and get the benefits that they are eligible for. And it is a problem. It's another aspect of the problem that I don't think we're having enough of a conversation about, and being creative in the ways that we can support immigrant communities to get access to the support that they desperately need right now.
And another issue that's going to have, we really are going to see an even growing divide is in this era of homeschooling and online education for our children. The English language learners are really going to suffer. And as you mentioned earlier, the correlations are strong between what's happening in your early education and later outcomes. So there's a real concern about those English language learners now too, who are slipping between not having a parent in the house who can guide what the teachers are sending your way is a real problem.
And this is not directly related to immigrants, but when Angela mentioned specific problems for English language learners in education, it made me think about the other subsets of students who are struggling even more, and students with learning disabilities who are not getting the services that they need to be able to take advantage of their education, or the way that we're not supporting students' emotional and social development and learning and needs as well.
There's two questions I want to put out and see what you think. One is, other than donations, given your point about the nonprofits suffering, what are the ways that we can organize and support nonprofits focused on addressing the racial disparate effects of COVID-19? And then there's another question, let me get to it. How should we reimagine mutual aid and grassroots organizing in light of the pandemic? So what are the possibilities here for people who are listening, or for any of us, in terms of action other than voting? That's my favorite answer, is vote, vote by mail, vote, vote, vote. But what else could be done by people in the community to support better answers to these questions that are being asked?
Mm-hmm. So I have a list of things that sound really simple, but they really matter when people are in a time of crisis like this. So, you know, for people who are interested in helping those who are releasing from jails and prisons, and it turns out if you're a person of color, you're less likely to release to stable housing. So consider partnering with your community groups, donating backpacks with non-perishable food, toothbrushes, toothpaste, and containers for medication. It's a simple thing that anybody can do just to prepare people for the basic first days after release. Mental health providers, you know, thank you for the good work you're doing, and please do more, continue to volunteer. We're really worried about the uptick. You know, you heard in the introduction, I'm also involved in the NYU Opioid Collaborative. We're really worried about the uptick in deaths of despair. So if you know anybody who's vulnerable, reach out, check in. And then a big one is devices. So there's a huge digital divide, and it falls on race ethnic lines. If many of us have unused devices in our homes, just please donate that device. It can help a child who cannot now access his or her educational materials. It can help a person coming out of custody have a lifeline to the services that have now all moved online. So many of them have moved online. And if you can't reach them, there's nothing to do. Donate to your food banks, and then really importantly, like, just become a mini political activist. Call your governor, write to your governor, stay on your governor, stay on your governor. It does make a difference, and ditto for the state representatives. And then Ellen, you had it, nothing can beat voting.
And is there a particular place in New York that you would have people donate devices?
You know, I think it's always, there are schools. I mean, if you check in with your local, check in with schools in the neighborhoods where you know there are concentrations of poverty, those schools will know the children to get those devices too. And the same thing with the reentry groups. We have, you know, amazing groups who are working with reentrants in New York City. So whether it's the Osborne Society or the Fortune Foundation or any of these groups who are really doing a lot to bring people home, and they're providing them, they'll know how to get those resources to the right facilities and help get into the right hands. So those donations can go a long way.
I will stress the voting as well. Everyone should vote, not just voting in federal elections, voting in all elections. I think this pandemic has shown us how important our state and local governments are to providing a safety net. But to kind of specifically focus on the part of the question that talked about supporting nonprofits, I think it's incredibly important for us to, like, even when thinking about nonprofits, to think locally. I'm a member of the board of the ACLU, so I'm not saying this to not have folks support national organizations. They need support as well. But I also want people to think about community-based organizations who don't have the broad-based support generally, and even the members of the community who generally support them are struggling and may not be able to support them now. So to think about local community organizations, not just in terms of giving your dollars, but in terms of giving your time and other resources. So there are community-based organizations that are trying to supplement the loss of education that many in the community are going to be experiencing. And they need folks who can volunteer to be tutors for things like physics or math or French that parents at home are not really able to provide the support. They need folks who can give the kind of enrichment curriculum that's missing. So someone who can volunteer to teach a photography class online, to make sure that all of these kids are getting the well-rounded, rich education that they're missing out on from not being able to go to school. I also want to just stress the ability to organize, to really take action in a way that we haven't been able to before, because there's so many supports put in place for us to be able to take action and organize from home, to use the internet and use those tools. And so folks should try to organize as well. But just to stress, we talked about collaboration in the beginning and bringing different perspectives to the table. Bring whatever skills and resources you have to these community organizations that are supporting individuals who are often overseen. So the lawyers and the teachers and social workers and artists, whatever, someone who can just volunteer to read to kids. All those things can be done online now and are being done online. And they need as many bodies as possible to do that and participate in that effort.
So we're getting very specific questions. So I'm going to go back to you, Angela. What are some of the organizations that we can contact to help recent people coming out of custody? So you talked about Osborne and Fortune, but just say those again, be clear about what those are. And then my sister-in-law texted me on my own phone to say, as a retired teacher, can I get linked up with special needs kids? And where can we send these food bags for released prisoners? So we're getting very specific questions.
So there's the two I mentioned are in the New York-based ones, and then there are other national ones. And to piggyback on what Deborah was saying, especially to any NYU student who's tuned in right now, your skills are a lifeline to people who need to learn right now. And this is true not just for students in the community or kids in the community. For the first time right now, a number of prisons are allowing people to live come in. So if you get approved and vetted, you can come in and do training remotely. So you can teach people how to code. There's coding going on. There's a nonprofit called Persevere that's putting together a network of coders across the country to allow people to learn to code behind bars, just providing skills before release. Not the only example, there's lots of examples like that. The Osborne Society is really focused on kind of family issues, and they work in correction systems and prisons throughout New York State, and also making sure people come home safely. The Fortune Group they're in New York City, they're in our backyard. They find ways of putting people into housing, the sorts of housing that makes sense depending on who they are and what their needs are. Job training, their CEO, which is really a great place for re-entrants to go to learn some vocational skills that they need in the community. So there are lots of ways to find, and this is just, there are these organizations all across the country. People have our contact information. They should reach out, let us know where they are, and we can connect them to the local organizations that we know are doing a great work in their backyard. But even just, if depending on where you're living, if there's a local facility, reaching out, and they are usually re-entry. They are staff often focused on re-entry. And if they connect with those people, if you're in Illinois or Washington State, to say, hey, I belong to this group here. This is what we managed to put together. Please let us be helpful. Obviously, there's, we want to make sure everyone stays safe. So there's quarantining processes and all that. But where there's a will, there's a way, and people can get connected and make a difference. And then also just friendly ears. People need mentorship, and actually just they need like people who care, and caring goes a long way.
So we're getting towards the end. Are there final comments from either one of you, Angela or Deborah?
In the questions and answer box, someone mentioned that a lot of the Black and minority-owned businesses are having trouble accessing PPP funding. And that is actually something I've heard as well, that many are being denied that funding from big banks and are only finding support and partnership with local community organizations. It's concerning. I saw one report that 90% of Black and Latinx businesses were being denied PPP funding. And it's really going to contribute and widen the racial wealth gap if these minority-owned businesses are not getting the support. So for folks whose minds think that way and are in the business arena, I really hope that people will think about how to support those businesses and struggling communities that didn't get access to the funding that can help them stay open and need other folks to help them.
Angela?
So I'm just going to conclude with being a mixed bag. I'm going to be a Debbie Downer and say that we're going to see in many ways, I think some of these inequalities increasing. We talked about the educational issues. Even if we look at who's being granted parole, there are inequalities in that, and it's compounded by so many different issues. I had a prosecutor on the phone recently, a progressive prosecutor, so frustrated that she couldn't get more men of color to return, but they didn't have housing to go to. And she herself is a prosecutor of color who's really trying to solve this problem, and there's so many issues to deal with. But on the other hand, so yes, problems, and they're going to magnify in so many ways. On the other hand, I do think we're going to see the budget crisis result in, and public opinion changes result in substantial criminal justice reform.
I just to wrap up, I also want to say again, I'm concerned that we'll only focus on COVID-19 related problems in the near future. And of course we should do that, but I hope that people will of course still focus on challenging those structural inequalities, that there will still be people who are focusing on educational equity and school segregation, people who are still focusing on challenging mass incarceration more broadly, and addressing those types of systemic longstanding problems.
For me, I'm going to quote Deborah, the sort of notion of not taking, stop taking no for an answer, right? I think we have seen what is possible when people come together, and I hope that this conversation has encouraged each of the people who've been listening to figure out what they can do to make a difference, and to join together to make sure that our attention doesn't waver from the important issues of justice going forward for years to come. I want to thank Angela and Deborah again. I look forward to the three of us being together in person at some point in the fall, but thank you very, very much for this conversation.